My name is Pratiksha Bhosle. My today's topic is types of adverse event. Firstly, we learn adverse event. Adverse event means any untoward, unintended medical occurrence in a patient or investigation or a clinical trial investigation administered a medicinal product and which does not necessarily uh, have to a casual relationship with this treatment. It means event. Adverse event have totally the three types: serious adverse event, suspected, unexpected, serious adverse reaction, unexpected adverse reaction. First is unexpected adverse reaction. An adverse reaction, the nature or severity of which is not consistent the with the applicable product information. Example: investigation brochure for an unauthorized investigational product of summary of product. Characteristics for an authorized product. Uh, uh, this type is previously unknown or reaction which is not mentioned. Second type is unexpected, unintended, serious adverse reaction. In that, an adverse event which result in death is life-threatening. Then this event requires hospitalization or prolongation of existing hospitalization. This adverse drug reaction result in persistent or significant disability or incapacity. It include also medically significant. It means it totally depend on medical attraction, or it occurs a medical medical attraction consists of a congenital anatomy or the birth defect. It means in that it include the thalamoid defect or infection in um pre pre pre-child baby. In serious adverse event, an adverse event is any undesirable experience associated with the use of chemical product in a patient. The event is serious and should be reported to FDA when the patient outcome is death, life-threatening, hospitalization or prolongation of existing hospitalization, disability or permanent damage, congenital anomaly or anomaly or birth defect, required intervention to prevent permanent impairment of damage. In that first date in the date report, if you suspect that the defect death was an outcome of the adverse event, and include the date if known. Second is life threatening. In the life threatening report, if suspected that the patient was at substantial risk of dying at the time of the adverse event, or use or continued use of the device or other medical product might have resulted in the death of the patient. Third one is hospitalization. In the hospitalization, emergency room visits that do not result in admission to the hospital should be evaluated for one of the other serious outcomes. In the disability or permanent damage report, if the adverse event resulted in a substantial disruption of a person's ability to conduct normal life function, that is the adverse event. Result in a significant, persistent or permanent change or physical activities or quality of life. Then the third is birth defect or congenital anomaly. Report if you suspect that exposure to a medical product prior to conception of during pregnancy may have resulted in an adverse outcome in the child. Third is next is other serious important medical events. Report when the event does not fit the other outcomes, but the event may jeopardize the patient and may require medical or surgical intervention. Example include allergic bronchospasm requiring treatment in an emergency room, serious blood uh, dysphasia or seizures convulsion that do not result in hospitalization. Thank you.